Hello, and welcome to the 2021 A Times for Health. My name is Josephine of Kenya, and I'm a board member and ambassador for the Elizabeth Glaser Pediatric AIDS Foundation. This year's event will be slightly different than previous years due to the COVID pandemic. And rather than be deterred from honoring our heroes, we have chosen to gather together virtually. Before we start today's program, I want to offer some housekeeping notes. One, because of the high number that we are, everyone's audio will be muted. The event is also being recorded, and this will be made accessible after the event at the pedaids.org or at the Time for Heroes 2021. Lastly, if you have any technical issues or questions, please feel free to message Manishla directly in the chat feature of the event. The first A Time for Heroes was held 33 years ago by Elizabeth Glaser and her dear friends, Susan De Laurentiis and Susie Zigan. These three extraordinary women were committed to raising funds for research and treatment for children in the early days of the AIDS pandemic. Back then, not so much was known about the virus, and the needs of children living with HIV were often ignored. But after and because of the events and efforts of the EGPAF founders and events like this one, pediatric HIV began to receive the attention and funding it deserved. And today, A Time for Heroes continues raising funds needed to fight for an end in AIDS in children, youth, and families around the world. That is why we are here, and we are thanking you today for joining us. As someone who has been part of the EGPAF family, I can testify to the importance of the support that EGPAF provides to children, youth, and families impacted by HIV all around the world. I was born in Uganda, and after learning about my HIV status as a young girl, I enrolled in a support group for children living with HIV that is named after Elizabeth Glaser's daughter, Ariel. The area clubs connected me with other children like me, and it gave me the support and resources that I needed to overcome the stigma that so many people face out there. Since my time in the area club, I've gone on to earn my bachelor's in social work and become a youth counselor. I've spoken at global conferences and before members of the US Congress, where I told my own story about my time spent in area club and how it motivated me as an individual to start advocating for other people, other young people living with HIV. And because of that, I've been awarded in 2016, I was awarded the 2016 Queen's Young Leaders Award for the advocacy that I've done on behalf of young people living with HIV. All that I've done would not have happened to me without the steady support and the love and the care that I received from the foundation, because it has helped me and it helped me realize a dream that I could live a full and healthy life that is not defined by my HIV status. Today, you'll hear remarks from leading technical experts, from health advocates, and from EGPAF's president and CEO, Chief Lives. Together, they will talk about the important steps EGPAF is taking to end pediatric HIV while countering the deep disruption of COVID-19 as we work each day to achieve an AIDS-free generation. But before we go into that, I would love you to please enjoy this video. It is commemorating this year's A Time for Heroes and EGPAF's incredible partners and heroes. Please enjoy.
We are aware of the devastation that the HIV pandemic has created over the last 40 years. As a continent, we need to embrace a new public health order That speaks to the need to invest in strengthening health systems with domestic resources. That speaks to the need to strengthen our public health institutions.
40 years ago this year, HIV was a death sentence, and now it's become a chronic manageable disease for those who have access to treatment and support.
In 2014, Johnson & Johnson had a vision of supporting most vulnerable patients, children, adolescents, and young adults in need of second and third line treatment. Our lessons have shown that the technical tools we develop are in demand and are well taken on the continent and beyond.
As we think to the future, it's going to require us to continue to innovate, both in the lab and the last mile.
If we have young people at the forefront of all the services provided for young people, then we'll have more young people taking the services. When I look at my daughter who is HIV negative, I feel so proud of myself. With all the challenges that I had during my pregnancy, I was able to take my medication so that she's HIV negative.
This very fruitful collaboration has proven itself so valuable to those in need and to the global community of healthcare.
I have much confidence in the future with partners like EGPAF, in addition to leaders like Dr. John Nkengasong.
Collectively, we look in one direction and see the same goals and targets.
Working together, we can reach an AIDS-free generation.
Hello, everyone. Thank you very much for joining us for A Time for Heroes this year. It's our celebration of a long history of successful partnership at EGPAF. My name is Chip Lyons, and I'm the very lucky CEO of EGPAF. As this audience very well knows, the COVID-19 pandemic has challenged the global health community more than ever before. We have to work together to end two pandemics at the same time. And obviously this is a monumental task, but one that we are already taking on, as are many of you. I'm extremely grateful that each of you have committed to supporting our mission and have chosen to join us virtually today so we can continue our tradition of honoring the heroes who help EGPAF fight for an AIDS-free generation. We could not be more pleased to honor this year's heroes. Each of them in their own way is really a transformative leader who understands the challenges our community is currently facing, and most particularly, they possess the will and personal dedication to simultaneously navigate the challenges COVID pandemic has put in front of us. If we are to end AIDS in children, youth, and families, and we are to end it, we need to address the way COVID has affected and disrupted health services and our fight for an AIDS-free generation. There are a lot of recent reports showing different things, but as of September, over 1 million children have lost one or more primary caregivers to complications from COVID. The Global Fund reports that COVID-related disruptions have significantly eroded HIV testing rates, as well as the number of people reached with HIV prevention services. Our EGPAF colleagues know the same from their own work at site level with the support that they provide. The disruptions are severe. And we have to remember the sort of baseline that we're dealing with. Today, only 54% of children living with HIV have access to the treatment that saves their lives. And although children accounted for just 5% of people living with HIV, in 2020, they represented 15% of all AIDS-related deaths. It's unacceptable. It's worse than that, but it's also unacceptable. And let's remember that almost 90% of all children living with HIV globally are located in Africa. EGPAF teams continue to adapt to these challenges, and with the help of our partners, we have scaled up our efforts to enroll expectant mothers in HIV care so that their children are born HIV-free. We know that if HIV-positive mothers are enrolled in the ART on a regular basis during their pregnancy, they can significantly reduce the chance of their baby contracting the virus. At the same time, we face the challenges of engaging and retaining children who have acquired HIV in effective HIV care. This year's corporate hero, Johnson & Johnson, is a supporter of EGPAF since 1991. J&J has partnered with EGPAF specifically since 2014 to tackle the challenges of pediatric HIV in sub-Saharan Africa. Their New Horizons collaborative has helped save thousands of lives. J&J represents the positive impact that the corporate sector can have in addressing some of the most daunting obstacles posed by the HIV pandemic. We're just thrilled to celebrate 30 years of partnership with J&J this year. You'll then hear from our Frontline Hero Award recipient, Dee Mpafitanka, an inspiring young woman from Lesotho. After learning of her status at 17 years of age, Dee works each day to end stigma and support young people in her community living with HIV to address stigma, come to terms with their status, and to live full and healthy lives, just as she does. As you saw in the video, our innovation hero is Dr. John Nkengasong, Director of Africa CDC, and President Biden's nominee to lead PEPFAR as Ambassador at Large and the coordinator of all US activities to combat HIV and AIDS globally. I have no doubt that Dr. Nkengasong will guide PEPFAR to develop and implement the necessary strategies that prioritize children, youth, and families in the fight for an end to COVID-19, leading to the emergence of the first AIDS-free generation. You're going to hear more about our honorees shortly. Finally, our keynote presentation is going to be delivered by Linda Gale Becker. Dr. Becker is an expert known to, I suspect, everyone on this. Nobody doesn't know about Linda Gale and her work, and the fact that she is an expert in pediatric HIV and TB from the Desmond Tutu HIV Center at the Institute of Infectious Disease and Molecular Medicine at the University of Cape Town. Linda Gale is herself a force of nature with deep expertise in the field and will lead us through a discussion on the importance of directly confronting COVID-19 as a global community if we are to end HIV as a public health threat. Let's hear about and from these remarkable leaders. Without further ado, please just sit back and enjoy today's program. Thank you.
Thank you so much, Chief. And our theme for this year's A Time for Heroes is creating an AIDS-free generation through meaningful partnership. As you will discover, each of the heroes we are honoring this year is a testament to the importance that meaningful partners play in the fight for an AIDS-free generation. Together, they demonstrate how community leaders, public health officials, and corporate partners can affect substantive change in the lives of thousands of people. Each of them, in their own way, are testaments to partnership. To present the first award, I'm pleased to welcome Edward Bitarakwate, EGPAF's country director in Uganda, who will present this year's Corporate Hero Award to Johnson & Johnson.
Thank you, Josephine, for moderating us this well. Hello, my name is Dr. Edward Bitarakwate, and I'm pleased to present the 2021 Corporate Hero Award to Johnson & Johnson. Of the 1.5 million people in Uganda who are living with HIV, 95,000 are children. Unlike adults, children have unique developmental needs that impact on the effectiveness of regular antiretroviral therapies. Therefore, as we scale efforts in our response to pediatric HIV, we must consider the unique needs of children living with or at risk of HIV. Johnson & Johnson has been a long-time supporter of EGPAF's mission since 1991. And since 2014, Johnson & Johnson has partnered with EGPAF in our work both in Uganda and across Eastern and Sub-Saharan Africa, helping us provide effective testing, treatment, and social support services to mothers, children, and adolescents living with or at risk of HIV. As a leading partner of the New Horizons Collaborative, Johnson & Johnson has helped support Uganda's Ministry of Health in establishing a curriculum for third-line HIV management, ensuring that regional treatment working groups, dispensaries, and local community organizations reach and engage children, youth, and families across the country for effective ART. Through their leadership in the New Horizons Collaborative, they have shown a deep understanding of the complexities of engaging children and their families in the care continuum. As part of our partnership, the number of people receiving ART in Uganda rose from 64% to 89% from 2016-2020. And today, 65% of children living with HIV are currently on effective antiretroviral treatment. Johnson & Johnson's partnership with EGPAF demonstrates the effectiveness that corporate entities can have in affecting positive and transformative progress in the fight against HIV. I humbly ask that you join me in welcoming Stacey Meyer, Johnson & Johnson's Vice President, Africa Implementation and Impact, Global Public Health, who will accept the award on behalf of the company. Thank you.
Thank you, Dr. Edward. I'd like to start by thanking the Elizabeth Glaser Pediatric AIDS Foundation for organizing this special event. It's an opportunity for us to recognize and celebrate all of the incredible work that's being done by our partners around the world to address these challenges of pediatric HIV and build the first AIDS-free generation. I'm also honored and privileged to be here today to accept the award on behalf of Johnson & Johnson. It's alongside champions, heroes like Dr. John Nkengasong and Dima Fati Tanka, who are making such a tremendous and positive impact on the lives of people living with HIV, especially during these challenging times. Since the first cases of HIV and AIDS emerged over 40 years ago, the HIV community has made a significant stride in the prevention and the treatment of the disease. And it's thanks to the power of solidarity, of innovation, and of collaboration. And one of the leading forces in this fight has been and continues to be EGPAF, an organization we are proud to call a partner. Back in 2014, Johnson & Johnson, EGPAF, and other partners came together to launch the New Horizons Collaborative. The goal of addressing critical gaps in pediatric HIV care and expanding access to a second and third line HIV medicines for children and adolescents living across sub-Saharan countries. It's proud to say to date, New Horizons has enrolled over 1,400 children across 11 countries on these therapies. This past summer, alongside EGPAF, we proudly announced a renewed commitment to New Horizons. We will build on the success of the program's first 7 years by leveraging lessons learned and make critical enhancements that will expand the program's reach and impact. And as part of this commitment, New Horizons will continue enrolling new HIV children through at least 2025. The success of New Horizons has been a personal highlight in my career, and I am particularly proud that because of the work we've done together, children have been able to continue being children, or as I like to say, the kiddos can just be kiddos. So this kind of cross-sector collaboration has been essential to the progress we have seen in the fight against HIV thus far. But there is much more to be done, and especially in the light of COVID-related disruptions that have reversed a lot of our hard-won gains, and building on more than 25 years of work in this field, Johnson & Johnson is committed to doing our part. In HIV, we are continuing to innovate, to collaborate from the lab to last mile, to accelerate new development, new medicines, and high technologies, health technologies, and ensure that there's equitable access for everyone, everywhere around the globe. We know that getting back on track for HIV will require effectively combating COVID-19. Johnson & Johnson is working closely with health authorities, governments, multilaterals, and more to supply our vaccines to communities around the world. It's including through our collaboration with the Africa CDC and the Africa Union, We've been grateful for the partnership and leadership of Dr. John Nkengasong in this effort. We know that we can do more together than we can ever do alone. And I'm confident that by working with partnerships with organizations like EGPAF and with the leadership of people like the heroes honored here today, we can and we will make HIV history. So thank you, Chip, and the entire EGPAF team for this prestigious award. We are so grateful for your partnership and your leadership in the fight to make HIV history.
Wow, thank you so much, Stacey. And thank you once again to Johnson & Johnson for your continued partnership in fighting for an AIDS-free generation. Next, it is my pleasure to welcome my friend and dear fellow ambassador, Jake Glaser, who will present this year's Frontline Hero Award.
Thank you, Josephine. Thank you so much for everyone for joining us today. What a special moment this is. It's been a wild, almost 2 years. And I just want to send my love and support to everyone out there listening today. My name is Jake Glaser. I'm Elizabeth Glaser's son, and I'm an EGPAF ambassador. I'm absolutely honored to be able to join all of you today for a Time for Heroes and present this year's Frontline Hero Award to a very good friend of mine, Dee Mpafitanka. Dee is an inspirational force for good in both her own community and around the world. After learning of her own HIV status, Dee used her voice as a young woman living with HIV to help other people in her community and around the world come to terms with their own status. As Chip mentioned earlier, Dee has overcome stigma and shame about her HIV diagnosis, but with the support of the network that she has developed over the years, Dee now has a family of her own. Dee is an HIV negative daughter. This is a reality that many young people like Dee in sub-Saharan Africa and across the globe deserve. And through your support of EGPAF's mission, they can achieve it. Her story is a testament to the effectiveness and importance of EGPAF's work, not only as it pertains to the medical breakthroughs that we're taking to end HIV, but the emphasis that we place on transforming negative sentiments of HIV stigma that deter people from achieving the care that they need to a world where they can flourish in spite of their status. Dee, congratulations. I'm absolutely proud, and I feel it so deeply in my heart to be able to welcome you not only into our family years ago as a friend and as a sister to me in this fight, but to be able to witness your growth as a young woman and as an EGPAF ambassador, and to now be able to call you a frontline hero. So Dee, congratulations. I love you from the bottom of my heart.
Thank you. I love you too, Jake. Hello, everyone. My name is Dee Mpafitanka. Thank you, Jake, for the warm welcome. I'm honored to receive the Frontline Hero Award from an organization that I proudly represent. As a senior youth ambassador for the Elizabeth Glaser Pediatric AIDS Foundation in Lesotho, I work with the Grassroots Partners organization to empower adolescent girls to access HIV services and develop life skills to stay healthy and strong. In Lesotho, HIV is a leading cause of death, and today about 130,000 children and young people under the age of 15 are living with HIV. After I tested positive for HIV when I was 17 years, I was so surprised by the lack of support I received, even in the health facility. I felt alone and isolated, and that my dreams for having my own family would never be realized. Thankfully, I learned of EGPAF support programs, and I was able to receive the support I needed to overcome the stigma around HIV. This support made me feel more empowered and more connected to the community of peers like me, and ultimately I began to reach out and support other young people living with HIV. In my work as a youth ambassador with EGPAF, I mobilize for youth to access the health services and emphasize the importance of knowing their status. For those who test HIV positive, I provide psychosocial support by not only helping establish peer support groups, but strong bonds and true friendships between the members. At the same time, I'm fortunate to have received the care I need to give birth to a HIV negative daughter with my husband, who is also negative. I share my story to say that having HIV doesn't define me, nor does it end my dreams for a prosperous future. Thank you so much to EGPAF for honoring me with this award and continuing to allow me to partner with you in working to end HIV stigma and helping achieve an AIDS-free generation. Thank you.
Wow, thank you so much, Dee, and thank you so much, Jeff. That was a very warm welcome. I'm so proud to call you a friend and could not think of anyone else deserving this award. So please welcome, join me and welcome EGPAF's Vice President of Technical Strategies, Dr. Apollo Tian, who will present this year's Innovation Hero Awards. Doctor, you're welcome.
Thank you, Josephine. Good afternoon and good morning, everyone. My name is Dr. Apollo Tiam, and as Josephine mentioned, I am the Vice President of Technical Strategies and Innovation here at the Elizabeth Glaser Pediatric AIDS Foundation. I'm honored to have the privilege of presenting EGPAF's Innovation Hero Award to Dr. John Kengason. Dr. Kengason has dedicated his life to public health and is committed to ending global HIV, TB, and even COVID-19. A prolific virologist, he has authored and co-authored over 250 peer-reviewed papers and book chapters in professional journals and has held posts such as the first director of the African Centers for Disease Control and Prevention. He understands how data drive effective public health policy and has served as a board member for the International AIDS Vaccines Initiative, as well as the Coalition for Epidemic Preparedness Innovation. As a special envoy for COVID-19 at the World Health Organization, Dr. Kengason has addressed the impact that COVID has had on the global community. While his resume is incredibly impressive, Dr. Kengason's humility and dedication to improving the lives of people living with or at risk for HIV set him apart as the right, uniquely qualified nominee to lead PEPFAR as the ambassador at large and coordinator of United States government activity to combat HIV/AIDS globally at the Department of State at this important moment in history. And as a fellow Cameroonian, I am particularly honored to present this award to Dr. Kengason. I know he understands the challenges people across the continent face regarding the dual pandemics of both COVID-19 and HIV. I have no doubt that as the future leader of PEPFAR, he will lead with empathy, passion, and expertise to help us secure an AIDS-free generation. Unfortunately, Dr. Kengason could not be with us today to accept his award and send his regrets, but he did videotape some remarks to commemorate the occasion, which we will share with you now. Congratulations, Dr. Kengason.
Chip Lyons, the CEO of the Elizabeth Glaser Pediatric AIDS Foundation, Dr. Apollo Tiam, the Vice President of Technical Strategy at Elizabeth Glaser Foundation, distinguished invitees, ladies and gentlemen, it is a great and deep honor to receive this year's Elizabeth Glaser Pediatric AIDS Foundation's Innovation Hero Award on behalf of my colleagues at the Africa Centers for Disease Control and Prevention in recognition of its outstanding leadership, especially during the COVID-19 pandemic, despite all the challenges. This award is testimony to the significance of the role that innovative health solutions played, especially as the world grapples with the pandemic, and also a reminder that more work needs to be done to create a safer and healthier world. The past 20 months have been both challenging and rewarding in guiding the African continent in its battle against the COVID-19 pandemic and in building resilient health systems. It has been an enriching experience working with all the staff of Africa's CDC, the African Union Commission and member states in our battle against the COVID-19, and one that will always warm my heart to be part of a noble cause as demonstration of Africa taking its health security destiny in its hands. The challenges that we face are huge and cannot be met only with investment from the public sector. We have to and must strategically include the private sector and other partners like EGPAF so that collectively we are aligned with the same vision and goals and targets to achieving the overall health security for the continent. Regional health security means global health security. Our partnership with the Elizabeth Glaser Pediatric AIDS Foundation continues to be strong and critical for achieving the vision of an AIDS-free generation as we continue our important work on the front lines of HIV/AIDS and COVID-19 pandemic. Today's virtual celebration features the progress that has been made in HIV/AIDS pandemic, highlights innovative approaches necessary to address the unique challenges facing children, youth, and families in the global AIDS response, particularly in light of the COVID-19 disruptions. I would like to express my profound gratitude to the Elizabeth Glaser Pediatric AIDS Foundation for conferring on Africa's CDC such an honor. This award has humbled us and thus caused me in particular to further reflect, and perhaps mostly, I hope this award demonstrates that our collective small efforts can accumulate into huge and remarkable results. Allow me to also congratulate my fellow invited honorees, Stacy Myers, the Vice President of Global Public Health Operations and Partnership at the Johnson & Johnson for the Corporate Hero Award. I've come to know Stacy over the last couple of months as a dedicated public-private sector hero, and I'm very delighted that this award has been given to you. Dear Mfapi Tankar, the Elizabeth Glaser Pediatric AIDS Foundation Senior Youth Ambassador for the Frontline Heroes Award. Congratulations to both of you. Let us together continue to build a better, resilient, and safe world. Safeguarding the Africa's health and creating an AIDS-free generation should remain our ultimate goal. And together, I'm very convinced that we can achieve the goal of ending AIDS in the not too distant future. I thank you so much for the recognition once more.
Well, that was impressive for a variety of reasons, including the fact that Dr. John found out he had to be at a different location because of a very pressing matter at the time of this, sent his huge regrets. And on top of all of his other responsibilities, he managed somehow yesterday to record that so that there was at least his presence and his voice and his conviction where he expected to be in person in joining us. So thank you again to the heroes and to the presenters. I'm conscious of time. I'm going to spare Linda Gale listening to an introduction with her credentials. I'm just going to go straight to Linda Gale. We have a special presentation because we're working in a very special, that's not the right word, an intensely complicated and challenging environment. And people like Linda Gale, as well as Apollo and Dee and Josephine and Edward and Stacy and others are the sources of our optimism that we are going to get through this. We are going to control COVID and then COVID. We are going to control and HIV, particularly for kids and young people. Linda Gale, please. We're looking forward to your remarks.
Well, thank you, Chip, and the broader EGPAF team. It's a real pleasure, and I'm delighted to provide remarks at this wonderful event. And allow me once again to congratulate the frontline heroes, but also at this moment to pay great tribute to the extraordinary contribution that the Elizabeth Glaser Pediatric AIDS Foundation has made to the global HIV response over many years. And it's a pleasure to see you as well, Jake. So launching into a few remarks that I hope will be hard-hitting, because I intend them to be such. And in the next 10 to 12 minutes, I hope to discuss matters concerning children in terms of where were we before COVID-19, where are we in the midst of COVID-19, and indeed what must urgently be done. You've already heard there are 1.7 million children living with HIV in the world today. Almost half were not on life-saving treatment in 2020. That amounts to 800,000. And numbers, if anything, declined in 2020. 1/3 of children born to mothers living with HIV were not tested. And untreated, 1 in 2 babies die of AIDS before their second birthday. And a clear 150,000 children were newly infected with HIV in 2020, 4-fold higher than was the target of 40,000. Indeed, the recent campaign, Start Free, Stay Free, AIDS Free, has just issued its formal end of campaign report, where sadly, not a single of the 2020 goals was actually met. And these include reducing new infections among children, reaching and sustaining pregnant women with life-saving treatment, reducing the number of new infections amongst adolescents and young women, providing voluntary medical male circumcision as an additional prevention option, providing life-saving treatment to children, and providing life-saving treatment to adolescents. We have seen some successes, and we should celebrate those. So definitely we've seen some progress towards the elimination of mother to child. We see ART coverage amongst pregnant women living with HIV going up to 85%. And we did see reductions in the number of young women and girls acquiring HIV in 2019. As we look back over the last 40 years, there too, we should celebrate the successes. From a time when 1 in 3 children born to women living with HIV were guaranteed to similarly face a lifetime of HIV. And as I've already mentioned, most of them die before their second birthday. We have moved treatment from a handful of difficult to take medications to a simple once-a-day drug. And beyond that, as you heard, we now are able to offer second and third and salvage therapy, which helps us to keep young people and children alive for the kinds of chronic but manageable conditions that Stacey mentioned in her remarks. But 22 years later, and we've had these tools for some time, it is a tragedy that we still see children born with the positive status of HIV. Many of these due to missed opportunities. Let's delve into those missed opportunities a little more. On the side of pregnant women living with HIV, There were opportunities to provide prevention, such as pre-exposure prophylaxis, that we missed. On the side of ensuring that every mother received antiretroviral therapy, there were opportunities for differentiated service delivery that we missed. And in terms of making sure that women know that they need to register early and be tested for HIV, there were opportunities for education, information, and community support to those young women that were missed. Finally, there are new technologies that we have shunned and turned away from that could make a difference in providing those gaps. We've concentrated in the last 20 to 30 years on the adult population, and we've certainly seen some progress there. So here you see the UNAIDS 2020 targets of 90, 90, 90. And although not perfect, we certainly have been making some progress there. But whilst doing that, we have misplaced the children. 11 countries account for 70% of the missing children. This is simply unjust. Children are 40% less likely than adults to be on antiretroviral therapy. We seem to be behind the target on every front when we consider children and adolescents. Here you see viral suppression rates in adolescents and young people, and on every side, they are behind adults, except for Namibia, where there has been a concerted effort to pay attention, particularly to young women and girls. And here we pay tribute to the leadership in that country. The resonating message again is this is disproportionate. Children are 5% of all people living with HIV, but account for 15% of all AIDS-related deaths. And here you see we have made no dent in the AIDS-related deaths for adolescents aged 10 to 19, a travesty that on this continent, it is one of the most common reasons that adolescents will face an early death. And roll on 2020 and the new world with COVID-19 to face as a challenge. This continent is thought to have been more likely hit by COVID-19, but in fact, we know that the official numbers belie the truth. My own country, although officially 90,000 people have died, actually threefold more than that lives have been lost nationally from natural causes than would have been expected. And these peaks in lives lost follow the waves, the three waves that we've had to shoulder on the continent alone. A good number of them young people. And again, when we look at important statistics such as vaccine access, this continent again, slow in uptake, left behind, and described as the slowest of the three rates of vaccine provision. COVID-19 has the potential and has already shown what it can do in dinging every single aspect of our provision of care, all the way from demand creation, getting people in the door for prevention, through to access to treatment, and ultimately viral suppression. We know that the impact has been on our health facilities as well as on our community-based services, and much of the work done to provide a differentiated approach within the HIV response has been hard hit by COVID-19. Chip mentioned how HIV testing fell 41% in 2020 in this Global Fund report. TB referrals fell almost 60% in 2020 compared to 2019. It's not all doom and gloom. We did see what we could do in the face of hardship. And in fact, COVID-19 catalyzed some innovation and some opportunities to integrate, to move forward with differentiated service delivery, and to provide more. So for instance, we saw multi-month refills being promulgated, patient triaging, one-stop shop clinics, redirection of services, out of facility care and community-based care, as well as telephonic consultations and out of facility pill pickups. But there is no doubt we will feel the impact of COVID for a long time. And here, just to illustrate this, is a model that predicts almost 200,000 additional stillbirths over the next 12 months. We know that other essential public health measures also will be missed, particularly in children. 80 million children under the age of 1 may miss out on receiving life-saving vaccines. The impact on poverty and hunger we will feel for a long time. An additional 140 million children projected to be in households living below the poverty line. And we are all aware of the impact on schooling, on education, and well-being in children and adolescents, with approximately 150 million additional children living in multidimensional poverty and 463 million children worldwide unable to access remote learning. Vaccination may be one of our options, our off-ramps to get out of this situation, along with the need to ensure that we strengthen our health systems and integrate care as much as possible. But here is a plea for global equity when it comes to the redistribution of vaccines around the world. So in my last minute, what is to be done? Well, without doubt, I suggest that we have to urgently, collectively move out of our complacency today, roll up our sleeves and start the work today. This means we need to do this with resolve and hold ourselves equally accountable. And this time, I would argue, let's finish the job. It means we need to reach pregnant women and ensure that they are tested frequently and treated with urgency, that we continue without break and in a differentiated way their antiretroviral care so that they too can attain viral load suppression. The powerful concept of undetectable equals untransmissible. And we have to prevent new infections through better prevention strategies, differentiated prevention, including pre-exposure prophylaxis in all of its forms. We need to find those missing children and treat them with great urgency, and here to invoke new technology that we already have at our disposal for early diagnosis. And lastly, but not least, we certainly need to find, retain, and ensure that adolescents stay within our care and receive the differentiated, tailored care that they need to reach their futures, their hopes, and their dreams. It is indeed a time for all of us to become frontline heroes. Here I would like to give the last word to another great hero who has just turned 90 years old and believes without doubt that children are the birthright and our inheritance and deserve more perhaps than what we have been giving them to date.
It is miraculous that the babies we thought would die in childhood are growing into fine young people. We must do all we can to bring them safely and healthily into adulthood.
And with that, I again pay great tribute to Dee, to Dr. John, to Stacey and J&J. Thank Chip and the EGPAF team again for this great honor. And again say, let's join hands to be frontline heroes and end the HIV epidemic for children.
Linda Gale. That was outstanding. That was needed. That was inspiring. It's not surprising. It's vintage Linda Gale, but I think we all needed that. everyone knows and feels that they've been knocked back and knocked down by COVID, but none of us more so than on the continent. And so it is a time that we have to step up. We have to do things differently. We have to do them with force, move out of the complacency. If anyone wonders in the face of all this why we remain optimistic about achieving the goal of controlling 2 epidemics, it's because of the resiliency on the continent, communities, individuals, but also the leadership that we're seeing from Dr. John to Linda Gale, the heroes that have been recognized, but they need our support. If among the other things that you take away from Linda Gale's presentation, I hope you remember just the 2 words, missed opportunities. That means that we can take advantage of those opportunities. We're not talking about a lack of medicine. We're not talking about a lack of diagnostics for kids. We did for a long time because they were missing. Those gaps have been dramatically filled. We have optimized formulations for kids that Linda Gale referred to. We have terrific diagnostics. We have to be more creative in finding the missed children. But I think you can see from everything that was in Linda Gale's presentation, everything you heard from the others, both presenters and honorees. The conviction is there, the experience is there, the expertise is there, the tools are there. And so we have a great deal of work to do. We have to help create the political and policy conditions in order to do that work. And we're up for that. We know how to do that. I want to thank everyone once again, congratulate everyone once again. Just seeing Desmond Tutu there just almost gives me a chill. There are very few more inspiring people than the Archbishop. But Elizabeth herself was one of those people. And the direct line for all of us from Elizabeth is Jake. And I want to thank you, Jake, for all of your conviction. You never miss an opportunity to encourage people, to share your love with people. It is returned to you. And we need that as we face another period of time, the remaining months of 2021, a slightly uncertain 2022 in terms of the course of COVID and so on. But what is really clear is what the agenda is and the steps that we can take and the importance of our partnerships together. And so with that, I want to thank all of you who have joined us for this hour. I hope you're as inspired and encouraged as we are. That's exactly why Elizabeth started this celebration of heroes. I certainly want to thank also Lula Bay and Bob Iger, J&J, and others who helped make this possible. Thank you, everyone. Have a great day. Be inspired. Continue with your own conviction and know that this work is possible to succeed at. Thank you very much.